2015. I am Queen Angelie Quiblat. So, our topic would be oral and maxillofacial surgery. Our topic composed of 7 branches. The first one would be procedures involved in soft tissue surgery. Second one would be procedures involved in minor bone surgery. The third one would be surgical procedures involved in fracture repair. And the fourth one would be procedures involved in maxillofacial surgery. Fifth one would be oral surgery procedures involved with TMJ dysfunction. The sixth one would be surgical procedures involved in implantology. The seventh one would be, or the last one would be, oral surgery role in aesthetic dentistry. So let's start off with procedures involved in soft tissue surgery. So we're gonna know what are the procedures involved in soft tissue surgery. So first one would be gingivectomy. So gingivectomy, it is a surgical excision of the unattached gingival tissue. And then gingivoplasty, it is the recontouring of the gingival tissues. Then we have the periodontal flap surgery. So as the name itself, it is mainly used for periodontal surgeries. And then it is a surgical excision and removal of pockets or tissue extensions. You can use laser or scalpel to section the tissue to remove the extensive singular pocket involvement, or when during tooth eruption. So it is mainly particularly in third molars. So because third molars kind of obstructs or impacts foods around the crown, that can cause gingival irritation and infection called pericoronitis. So frenectomy, it is the surgical removal or resectioning of a frenum. It can be performed on the maxillary labial frenum to correct diastema or the space between the two teeth. It is mainly found in the maxillary anterior teeth. And then, or the mandibular lingual frenum, it is to correct ankylosglosia. It is the shortness of the tongue frenum, or in another word, tongue-tied. Incision and drainage, I&D. It is the procedure performed for periodontal abscess. It is an incision made into the affected area, and opening is obtained to remove and drain infected matter. So from the word itself, incision and drainage. You incise and then you drain. So in some cases, small piece of rubber dam or iodoform gauze is inserted into the incision to maintain the opening for drainage. So incision biopsy. So removing a wedge-shaped section of affected tissue along with some normal adjacent tissue. It is the removal of wedge-shaped section of affected tissue. And then excision biopsy. So removal of the entire lesion of affected tissue. So incision, and if you compare the two, incision and excision biopsy, incision is just removing a part of the affected tissue, while excision is removing entirely the affected tissue. So exfoliative biopsy, it is the scraping with glass slide or tongue depressor to collect tissue cells for microscopic study. And then brush biopsy, it's much like the exfoliative test. It is a pipe steam brush is drawn across the mouth tissues, scrape against a glass slide, fixed with a solution, and sent to the lab for a computer-assisted reading.
For surgical procedures involved in fracture repair, we have the closed fracture reduction, repair with intraoral fixation, tooth wiring or ligation methods in which the teeth are wired together in proper alignment while awaiting bone healing. And then open fracture reduction, this is more complicated procedure which involves osteotomy and rigid fixation, perhaps bone plate, mesh, pins, grafts, and other fixation devices. Open reduction requires not only alignment by fixation of the teeth, but also repositioning and correction of fractures after surgical access to the periosteum. Procedures involved in maxillofacial surgery, we have genioplasty. This is a plastic surgery of the chin or the cheek. Chin size is classified in one of 6 ways. We have the macrogenio, which is larger excessive chin, macrogenia, microgenia, undersized chin, lateral excessive deficient, excessive bone in one direction and deficient bone in another. Asymmetrical, lack of balance of size and shape on opposite sides. Pseudomacrogenia, excess of soft tissue presenting a chin with the look of abnormal size. With chin, soft tissue ptosis or dropping or sagging of an organ. Osteotomy or bone incision, surgical movement of bone or osteoplasty to form bones or removal of the bone, usually completed with surgical burrs. Chin augmentation may be termed sliding the genioplasty because it is the option of moving the chin forward by making an incision inside the lower lip and then inserting an artificial chin implant or moving the severed bone tip segment forward. Ridge augmentation, the use of bone grafts to build or correct an underdeveloped or missing ridge, possibly needed for tooth or denture implant or preparation for denture wear. And then surgical correction in conjunction with the orthodontist and or the prosthodontist. The oral surgeon may expose and band or peg erupting the teeth to prepare them out for fixed orthodontic. Arthrotomy, this is cutting of the joint. So you do reconstruction and alignment of the mandible for the TMJ disorders. The mandible could be altered to obtain one of the 3 movements. It could be retrusive lateral or distolateral or mesiolateral. Cleft lip repair, tissue fissure or incomplete juncture of maxillary lip tissues. This is a congenital defect. And then cleft palate repair, congenital fissure in roof of the mouth with an opening in the nasal cavity. It could be unilateral, meaning one-sided or bilateral. Also, it could be complete or incomplete. Orthodontic surgery, surgical manipulation of the facial skeleton to restore the facial structure of the patient.
And next is oral surgery procedure involved with TMJ dysfunction. Medical tests used to determine malposition of the TMJ are computerized mandibular scan, electromyograph, electrosonograph, CT tomography, also known as CAT scan. Computerized mandibular scan, this imaging technique provides detailed images of the TMJ and surrounding structure, allowing for assessment of joint position and any malposition. The electromyograph, this test measures the electrical activity in muscles around the TMJ, which can indicate muscle dysfunction or imbalances related to the TMJ malposition. And the electrosonograph is ESG. This diagnostic tool uses sound waves to create images of the TMJ, showing its structure and any abnormalities that may be associated with malposition. And next is CT, which is called computed tomography, also known as a CAT scan. This imaging technique provides cross-sectional images of the TMJ and surrounding tissues. This is part of oral surgery procedure involved with TMJ dysfunction. The hemiarthroplasty, autogenesis reconstruction, alloplastic reconstruction, allograft reconstruction, xenograft, total joint reconstruction, and the revision surgery. So hemiarthroplasty, it's a surgical repair of a joint with a partial joint implant reconstruction. And the autogenous reconstruction is the rebuild of the joint using organic material supplied by the patient, just as a tooth or rib bone graft. The alloplastic reconstruction is it's a resorbable material that be using like synthetic man-made materials. And the allograft reconstruction is which can be tested like sterilized and accepted by patient body to rebuild the jawbone. It's taking from human donors. And the xenograft is harvested from animals, most commonly the cow, especially processed to become biocompatible. And the total joint reconstruction is the surgical intervention and use of the artificial processes of the condyle, discs, and fossa of the temporal bone. And the revision surgery, surgical correction of an area that has been operated on previously occurring when further degeneration happens, when obviously implants have failed, or when going from a partial joint implant to a total implant. And next is the surgeon may perform these following types of dental implant. These are the endosteel, subperisteel, transosteel, endodontic, and intramucosal insert. So endosteel implants is commonly type of dental implant where implants are surgically placed into the jawbone. So endosteel implants are suitable for most patients who have adequate bone height and density. The subperiosteal implants they are used when the patient has insufficient bone height or when the patient cannot undergo a procedure to rebuild the bone height. This is usually secured with posts that protrude through the gums to hold the prosthetic teeth. The transosteel implants, this is also known as mandibular staple implants. This type of implant is less common and typically used when other types of implants are not suitable due to bone structure or other factors. So the other term listed just as endodontic and intramucosal insert do not typically refer to the types of dental implants. So endodontic relates to procedures involving the dental pulp and root canals rather than implants, And intramucosal insert might refer to dental procedure involving the mucous membrane of the mouth but not specifically to implants. So therefore, the most likely types of dental implants that a surgeon may prefer are endosteel, subperisteel, and transosteel implants depending on the patient's specific dental and anatomic needs. These are the implant material. When it comes to dental implants, the materials commonly used include titanium, zirconia, polymers, and composite, stainless steel, and cobalt chromium alloys, cobalt chromium molybdenum. So the titanium, uh, it is a widely used material for dental implants due to its biocompatibility, strength, and ability to integrate well with bone, like osseointegration. Titanium implants are durable and have a long track record of clinical success. The zirconia, they are white in color and can be a good aesthetic choice, particularly for patients with thin and translucent gum tissue. And the appearance of the tooth is excellent, and biocompatibility. The polymers and composite, these are the materials, are sometimes used in temporary or provisional implants. They are lightweight and can be easily shaped, but they are not as durable as metal implants and are typically used as temporary solution during the healing process. And the stainless steel and cobalt chromium alloys, uh, they are less common for permanent implants due to concern about long-term biocompatibility and the potential for corrosion. And lastly is cobalt chromium molybdenum. This alloy is stronger than stainless steel and can be used in dental implants, particularly in cases where high strength is required. It is often used in conjunction with other materials or in specific implant design. So among these materials, titanium and zirconia are the most commonly used for permanent dental implants, with titanium and being the standard due to its proven long-term success and compatibility. The zirconia implants are gaining popularity, especially in cases where state, state aesthetics are a significant concern.
And lastly, we have the oral surgery role in aesthetic dentistry. So first is the cleft tongue repair, which addresses a congenital condition known as bifid or split tongue, where the tongue typically is split at the tip, resembling a fork appearance. So the primary goal of this is to restore the tongue's normal appearance and functionality, enhancing the patient's ability to perform essential oral functions and improving their quality of life. Next is the cleft palate repair, closing of lip and palatine tissues combined with orthodontic treatment. So this cleft palate repair is a surgery to close the opening in the palatine tissue, and usually it involves rearranging tissues in the roof of the mouth to create functional separation between the mouth and nasal cavity. So the repair often includes the closure of the lip tissue if a cleft lip is also present, aiming to create a normal mouth structure and appearance. Orthodontic treatment, on the other hand, might be recommended for cleft patients later in childhood or adolescence to achieve optimal dental alignment and function. Next is the cleft lip repair, tissue closing and repair of opening tissue gap. Cleft lip occurs when the tissue that forms the upper lip fails to join completely before birth, resulting in a visible gap or split, and it may occur on one or both sides of the lip and sometimes extending into the nose. So cleft lip repair is a surgical procedure aimed at closing the tissue gap and reconstructing the lip to restore its normal appearance and function. Also, this may include the repair of underlying muscle and tissue structures to ensure the lip's functionality. Next is the cosmetic alteration. So some cosmetic repair or improvement work is necessary with extensive bone and tissue replacement or movement. So these are optional improvements to address congenital deformities, trauma, or the effects of aging on a person's appearance while they're undergoing major surgery. Examples that may be performed are rhytidectomy, excision of wrinkles by plastic surgery. So rhytidectomy, or commonly known as facelift, involves the excision of wrinkles and tightening of facial skin through plastic surgery. So this procedure targets sagging skin, deep creases, and loss of muscle tone in the face and neck, aiming to provide a more youthful and refreshed appearance. Next is the blepharoplasty, which is a plastic surgery of the eyelid. So this includes the removal of excess skin, fat, and muscle from the upper and lower eyelids. So the procedure aims to create a more youthful and rested appearance as well as to improve vision in cases where sagging eyelid skin impairs sight. Next is the rhinoplasty, which is a plastic surgery of the nose. So rhinoplasty is a surgical modification of the nose structure, which can include altering the bone, cartilage, and skin. So the goal is to enhance the nose appearance, improve its proportions relative to the face, and correct any functional impairments. Next is the septoplasty, which is a plastic surgery of the nasal septum. So it focuses on correcting deviations or deformities of the nasal septum. So the goal is to improve airflow through the nasal passages and to correct any structural problems that may be causing symptoms. Next is liposuction, suction of fat tissue of the neck. So this is designed to remove excess fat from the neck area to create a more defined and contoured appearance. So this procedure is commonly performed to reduce the appearance of double chin, improve the jawline, and enhance the overall profile of the neck. Next is the deep cheek or chin augmentation, improvement of tissue. So these are cosmetic procedures designed to enhance the volume and shape of these facial features, creating a fuller and more defined appearance. These augmentations can be achieved through various methods including dermal fillers, fat grafting, and implants. And lastly is the injectable Botox and chemical peel, which is a skin adjustment. So these are non-surgical cosmetic procedures aimed at enhancing the appearance and texture of the skin. So this treatment offer effective solutions for reducing wrinkles, fine lines, and other signs of aging, as well as improving overall skin quality. In injectable Botox, it involves the use of botulinum toxin type A, which is a purified protein that temporarily paralyzes facial muscles, reducing the appearance of wrinkles and fine lines, while the chemical peels involve the application of chemical solution such as alpha hydroxy acid, beta hydroxy acid, and or the trichloroacetic acid to the skin, which exfoliates the outer layers and stimulates the growth of new and healthier skin. And that ends our report.